Hello, I'm going to talk about granulomatosis with polyangiitis. This disease is an inflammatory damage to blood vessels. It usually causes epistaxis, that means nosebleed, joint pain, and fever. Other organs, such as the lungs, nerves, and kidneys, can be affected, causing progressing cough and shortness of breath, paralysis for peripheral nerve damage, or high blood pressure and kidney failure in advanced stage of the disease. In this case, a 17-year-old patient with non-asthma came to the Department of Neurology in Saudi Arabia for credentials and headache that had persisted for more than 5 days. Among her symptoms, she reported joint pain and rash. That means skin redness, tiredness, right facial paralysis and numbness of the right lower limb persisting for 1 year, runny nose, epistaxis, tinnitus, that means ringing in the ears, as well as white hair pain with yellowish discharge for more than 6 months, cough with symptoms and hemoptysis, which is the fact current of blood. She specified, "I was very sick, I was not able to sleep due to my cough and headache, and was not able to do my routine activities as I usually would. I was not knowing the exact diagnosis and was visiting various medical institutions. On admission, doctors had no specific idea about the pathology of this patient. Indeed, the symptoms are not really specific to one pathology. That's why they started a series of tests to guide the diagnosis. Physical examination found a septal perforation, nasal ulcers, and rash back of the right foot. Stethoscope examination revealed bilateral cracklings in the upper lobes of the lungs, while neurologic examination revealed facial asymmetry by damage to the facial nerve. The facial nerve is the cranial nerve which is responsible of the motor control of face's muscles. For example, it's thanks to this nerve that we can smile. Laboratory examination greatly assisted in the diagnosis. Indeed, the analysis of blood tests showed an increase in the sedimentation rate and C-reactive protein. These two parameters prove the existence of a generalized inflammation explaining the symptoms of the patient. Leukocytosis, that means an increase in white blood cells witness to a patent infection. Thrombocytosis, an increase in the number of platelets responsible for blood clotting, for example, explaining the rash, and the presence of PICA antibodies, which are found in autoimmune disease called necrotizing vasculitis, of which GPR is part. X-ray and the chest scanner found several cavitary lesions. The brain MRI showed cortical swelling paranasal sinus, as well as deviation of the nasal septums. Thanks to their investigation, doctors were able to make the diagnosis of GPA. This young patient was therefore able to start treatment, which included corticosteroid treatment to reduce inflammation, plasmapheresis, that is to say the collection of blood serum from bring the platelet count back as to normal, as well as an antiepileptic to stop convulsions. The patient responded optimally to treatment, resulting in a fast resolution of symptoms and a marked improvement in her quality of life. She also had reconstructive surgery to correct the deviation of nasal septum. I found this case interesting because it illustrates well the cases of diagnosis error due to the diversity of symptoms. Indeed, a nervous attack like here doesn't immediately suggest a disease preferentially affecting the vessels. Even if this clinical presentation is not the most usual, you have to know how to think about it. Indeed, medicine is not an exact science, and it should not be considered a symptom for a disease. We have to consider the globality of the imaging exam as well as clinical and biological information, particularly for war disease.